heart disease, we can summarize heart disease in 3 groups if you want. I mean, one group is the heart problems that comes with heart attacks or coronary artery disease. Then another group, you have the cardiomyopathies and the congestive heart failure patients. And there's another big group of the valvulopathies, problems with the valvular. Yeah, well, we see everything. Congestive heart failure obviously is very prevalent, and coronary disease is about the same prevalence. In San Antonio, this is very important because this population has a lot of risk factors. That includes chronic diseases like diabetes, high blood pressure, high cholesterol, sedentarism, overweight. All of these are, risk factors to develop coronary artery disease, heart attacks, and congestive heart failure. And we know that overall in the United States, cardiovascular diseases are the number one killer. That's a good question. I mean, typically, what the classical symptoms of an acute coronary syndrome or heart attack is chest pain. Usually, it's chest pain in the middle of the chest, very severe. Usually, the typical is that it radiates to the left arm or radiates to the neck. However, these are the classical symptoms, and in a lot of patients, and especially in women, we see that these symptoms sometimes are not that typical. Those symptoms include only back pain, shortness of breath, diaphoresis, only pain in the neck, or even dizziness or fatigue. So it's important. I mean, heart attacks are life-threatening. So we need to look for attention immediately. What are the risks? Well, short-term, the risk, you can die suddenly during a heart attack. Now, important thing, even if you don't die, the heart attacks happens when one of the coronary arteries blockage, stop sending blood to the heart muscle. So even if you don't die, if you don't go look for attention, then you can have heart muscle disease and end up with congestive heart failure that will end up with you for the rest of your life. So obviously, it's very important to look for attention immediately. Time is muscle during a heart attack. Call 911 if they are alone, and if they're with somebody, whatever is faster, somebody will drive them. I do not recommend for them to drive themselves. I mean, 911 is very quick, and that would be the right choice. We need to continue to control the risk factors. So a lot of patients with diabetes, high blood pressure, and high cholesterol. Obviously, a lot of patients in this category require medications. But don't forget that we need to do our part. The patients need to follow a low-caloric diet, low in salt. Also, try to stay active. Even during this pandemic, if you're at home, there are choices. I mean, you can look online for some exercises and try to find the way to keep being active. If you, I wouldn't recommend to go to the gym, but if you have a nice area outside your house and you can go for a walk, obviously trying to avoid crowded, places. But if you go early in the morning or late at night and then do walking or some bicycling, that will be good options. We follow all the precautions and follow the CDC guidelines just to minimize the risk, and the exposure to COVID. But that includes, everybody use special, personal protective equipment. We're checking temperatures every time we go in. We keep the safe distancing. We all the time, frequently hand washing. We do. To be honest, it's more risky to ignore your symptoms and don't go to your doctor that to be, to stay home. So it's very important. We take all the precautions, so you don't have to be afraid.